Vanakkam, good morning. In this video we are going to discuss about the deglutition or swallowing. Deglutition or swallowing is the important short notes from the gastrointestinal physiology. Deglutition is the swallowing of the food from mouth to the stomach is deglutition. The oral stage is the first stage of the deglutition. This is the voluntary control of the deglutition. This is a voluntary control of the deglutition. So when the food is enter into the mouth, it forms the bolus mixed with the saliva and round bolus. So it is the food is present in the postero-tarsal aspect of the tongue. This is the tongue, postero-tarsal aspect of the tongue. This is the preparatory position of the oral stage. So tongue is anterior part is retracted, depressed, posterior part is retracted and elevated, and bolus is enter into the pushed against the hard palate. The oral stage, tongue is pushed against the hard palate. It move the food into the mouth to the pharynx. Pharyngeal stage of deglutition is the involuntary control. So pharynx, the presence of the bolus in the pharynx can move to the mouth or nasopharynx or respiratory tract and esophagus. The prevention of the food enter into the mouth is prevented by the high intraoral pressure and approximation of the hard palate to the pharyngeal fold, and prevention of the food into the nasopharynx, entry of the food into the nasopharynx by the soft palate approximation with the uvula, and prevention of the food into the respiratory tract by the closure of the glottis and epiglottis. It produces the deglutition apnea, so temporarily stoppage of the breathing. Deglutition. So the deglutition reflex is sensed by the receptors present in the pharynx. Afferent is the trigeminal nerve, glossopharyngeal nerve, and vagus. Center is the nucleus tractus salitarius and nucleus ambiguous. Efferent is the trigeminal nerve, glossopharyngeal nerve, vagus nerve, and hypoglossal nerve. So this reflex is coordinate the entry of the food bolus into the esophagus and close the soft palate near the pharynx and increases the intraoral pressure. Esophageal stage of deglutition. This is involuntary. when the food is entered into the pharynx to the esophagus by the opening of the upper esophageal sphincter. So when the food is entered into the esophagus, it produces the primary peristaltic contraction due to the stretch. So the primary peristaltic contraction move the bolus into the under esophagus, so it will open the lower esophageal sphincter. So the primary peristaltic contraction increases the pressure up to the 10 centimeter water. If the primary peristaltic contraction not enough to push the bolus into the stomach, means the secondary peristaltic contraction activated. That is also helpful for the esophageal stage of the deglutition. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.